My patient Roman Zafar, 19 years old, unmarried, educated till metric, 1 out of 5 siblings, currently unemployed, from Peshawar, presented to the OPD almost 6 days back with the complaints of exacerbation of his pre-existing skin condition in the form of increased erythema and fever, along with pustular eruption predominantly involving his forearms from the last 6 days. According to the patient, he was in a normal state of health almost 12 years back when he started to develop erythema involving the left side of his cheek. It was associated with some burning and itching, but there was no scaling according to the patient. Without any improvement, in a span of about 1 month, it increased in size and spread to involve the rest of the face, predominantly his bilateral cheeks and his nose. His disease further aggravated in about 3 months' time when his existing lesion had not healed, and lesions of similar morphology also started to appear on the dorsum of his hands, his forearms, his feet, and his upper chest and his back. He started using some topical medications, but it only improved these lesions symptomatically, and some of the lesions on the face healed with atrophy and pigmentation. During this entire 12 years, he had multiple relapses and remissions, but he denies complete clearance of his entire body, and he has been admitted in the hospital for almost 8 to 9 times. Now, from the last 1 week, he reports an exacerbation of his existing skin condition in the form of increased erythema, predominantly on his face and his dorsum of his hands. He also reports a history of high-grade fever from the last 6 days, which was associated with an upper respiratory tract infection. He also reports some pustular eruption involving predominantly his forearms after application of topical medications. He also gives history of similar pustular eruption in the past after topical application, and that healed after the medications were discontinued. There is any denial of any other drug intake prior to this episode or the first episode. He also denies discontinuation or non-compliance with his medications before this flare. He denies any current exacerbating factors, but in the past gives history of photoaggravation, and he doesn't identify any other relieving factors other than his medications. The patient also reports pain and stiffness of the joints of his hands and feet. There is a morning stiffness that lasts for almost 3 hours, and he denies any swelling and redness in these joints. He also gives history of discoloration of his fingers on exposure to cold in the form of first they are pale and then become purple, and finally they become normal after rewarming for almost 30 minutes. The patient gives history of diffuse hair loss in the past and denies any history of any scaling in the scalp. He also gives history of some nail loss in the past, but currently, according to the patient, his also gives history of painful oral and nasal ulcers. The oral cavity predominantly involved the tongue and palate, and these lesions would heal in about 2 weeks with the use of medications. He doesn't give any history of any genital ulcers, although he does report some history of redness of his eyes, but denies any dryness or gritty sensation in his eyes, and also doesn't report any visual changes associated with these. There is no history of any urticarial eruptions that last for more than 24 hours. There's also no history of any mesh-like erythema on the body. The patient denies any history of bullous eruption involving primarily the photo-exposed sites. There is a denial of any muscle weakness or difficulty in standing from sitting position or climbing the stairs or performing any of his daily activities. He also denies any history of difficulty in swallowing or difficulty in opening his mouth or changes in the skin, such as hardening of his skin. He denies any history of generalized erythema of the body or any lumps and bumps in the body. He also reports some increase in his weight from almost 12 kg increase in about 3 months, which he attributes to the use of oral steroids. According to him, his appetite is increased and his food intake is also increased when he is on steroids. On systemic review, he doesn't give any history of any focal neurological deficit or any history of fits or headaches, no history of any sudden visual changes. He also gives history of shortness of breath for walking for almost 8 minutes. Shortness of breath when he walks for almost 7 to 8 minutes. There is denial of any history of shortness of breath when he lies down straight. There is no history of any palpitations or any irregular heartbeat